Also with me this hour, Dr. James McPartland. He's the director of the Yale Center for Brain and Mind Health and also professor of child psychiatry and psychology. It's good to have you with us this afternoon. A lot of reaction, first of all, to what we heard out of the White House this afternoon. And as you just heard from the FDA commissioner there, he stands by the fact that the White House says there is this actual causal relationship, not just an association. Is he right?
The most important thing that was said during that conference today is that autism is complex with a multifactorial etiology. And that is the truth. What that means is that autism is complicated and there's not one cause. There's not one cause that is Tylenol. There's not one cause that is related to folate. It's extremely complicated.
Given that it is so complicated, what do you make of this current guidance and what this means for not only those who are expecting children, but also even parents of children with autism?
Well, practically speaking, the guidance isn't very different from existing guidance. Existing guidance suggested to use Tylenol and any drug during pregnancy as sparingly as possible. So what was discussed today is actually very, very much in alignment with what's existed for a long time. Pregnant women should be consulting with their obstetricians to determine what's appropriate for them, given the risk factors that are associated with being ill during pregnancy.
As you just heard from Dr. McCary, he talked about as well what he said was a significant rise in the number of severe cases of autism, talking about people on the autism spectrum who are nonverbal, saying that this doesn't exist in Americans who are over the age of 60. Is that true?
That's not correct. There are many people with autism of all forms, including severe or profound autism of all ages. In fact, when we look at how diagnostic trends have changed over time, that's the segment that's been most stable. It's the people who have higher cognitive ability and more language that have been more included in the spectrum in recent years.
So when we talk about that, what exists, what we do know, right, in terms of the data, and also the fact that this guidance, in your view, is not that much different from what we know. What should the takeaway then be for people today? I mean, I spoke with an OBGYN earlier tonight who said her guidance will not change at all for her patients, but she is deeply concerned about how they will take this information.
Exactly, that people should be talking with the OBGYNs, understanding how their specific medical situation is relevant in this context. There are risks to not treating a fever in a pregnant woman.
The president made a number of claims. Among them, he said that there was no autism whatsoever within the Amish community. Is that accurate?
That's not correct. There is autism in the Amish community. In fact, because there's more genetic overlap among Amish people, there are specific studies that have focused on autism in the Amish community to learn more about genes.
Dr. James McPartland, really appreciate you joining us and appreciate your expertise, your insight. Thank you.
Welcome back. This morning, growing alarm in the medical community ahead of an expected White House announcement on autism.
I think we found an answer to autism. We're going to be talking in the Oval Office in the White House about autism, how it happens, so we won't let it happen anymore.
Now, according to 4 people familiar with the matter who spoke to the Washington Post, the White House will link pregnant women taking acetaminophen, the active ingredient in Tylenol, to an increased risk of autism in children. Current FDA guidelines say acetaminophen is safe for pregnant women to take, and that's backed up by decades of research. In a statement, Tylenol's parent company, Kenvue, tells NBC News without the drug, quote, women face dangerous choices, suffer through conditions like fever that are potentially harmful to both mom and baby, or use riskier alternatives. Let's bring in Dr. Vin Gupta, a pulmonologist and MSNBC medical contributor. Doctor, we've all been told Tylenol is the safe pain reliever to take when you're pregnant, and any possible link between that and autism has been thoroughly studied before, right? What do we know?
Donna, good morning. What we know is that there's been years of research prior to recently that's shown a correlation but not causation of Tylenol and maybe a very small increased risk of baby developing autism, very small. And those were poor quality studies, poorly designed. What we also know is that science changes, research gets better. And just a few years ago, one of the largest, best quality research studies ever done, of 25 years in Sweden, looked at siblings, one exposed in utero, the other not, to Tylenol. And what did that find? When controlling for genetics, family history, maternal, paternal age, known risk factors for autism, that there was no link. So the best quality research has shown no link between the use of Tylenol in utero or during pregnancy and the development of autism.
President Trump actually seemed to acknowledge this weekend that today's announcement could be wrong. Take a listen.
I don't want to wait any longer. We don't need anything more. And if it's wrong, it's not going to be wrong. But if it is wrong, it's fine that we have to do it. Because we're going to have an announcement on autism.
Dr. Gupta, your reaction. What are the implications if they make this link and they're wrong?
Well, it's going to be a similar line of things. You and I have talked about this endlessly of using a similar approach. They don't know. They put something out there and it's cherry picking data. I worry about women across the country, Anna. You said this in the tee-up. There aren't many options for oral pain relief if you have to take a medication. I say this watching my wife go through 2 pregnancies and needing, in some cases, pain relief. That it's important to treat pain during pregnancy. That's a risk factor to baby. And NSAIDs are not an option. Other pain relievers are not an option.
The president there just moments ago, as you heard him, alongside him, HHS Secretary Robert F. Kennedy Jr., as well as CMS Administrator Dr. Mehmet Oz and others, all claiming as well there is a link that they say they have found between autism in children and the pain reliever acetaminophen, of course known as Tylenol by its brand name, when used during pregnancy. Now, let's reset here with the facts of what we do know and the science. Acetaminophen is currently considered the safest pain relief option for pregnant women. Administration officials now are advising women, however, not to use it early in pregnancy unless they have a high fever. The health secretary saying that at this point there are no other options, so that doctors should still use their best judgment, but then went on to warn that they believed as well that this was associated with potential liver toxicity, even claiming it could prolong viral illnesses in children. The administration, as part of this announcement today, is also saying that folinic acid, that's a supplement, also you may know it as leucovorin, is a way to decrease the symptoms of autism. Secretary Kennedy has, of course, previously promoted debunked theories which link vaccines to autism. And he was just bringing that up again moments ago as we were coming on the air here at the top of the hour. The secretary, and just pardon me as I look at my notes here, noting that they are now investigating, in his words, multiple areas of causation when it comes to vaccines. He claims that 40 to 60% of mothers who have children with autism believe that there is some link to a vaccination. The secretary also claiming that these women have been gaslit, he says, by the science, which has found that there is, in fact, not a connection between vaccines and autism. But he is saying now that this is something that he has directed his agencies to look into. Again, he has promoted these theories linking vaccines to autism for some time. You may recall back in April, he pledged that his agency would have answers on the causes of autism this month. He said we would know in September. This announcement already sparking a lot of pushback from medical experts. The chief of clinical practice for ACOG, that's the American College of Obstetricians and Gynecologists, telling CNN in a statement, quote, "There is no clear evidence that proves a direct relationship between the prudent use of acetaminophen during pregnancy and fetal developmental issues." CNN medical correspondent Meg Terrell is joining me now. So, Meg, I know you've been looking into this for some time, listening as well to what we're hearing here from the administration, from the secretary. What is the science behind this announcement today?
Well, I'm not sure if we've actually heard them cite their specific studies, but it had been thought that they might cite an analysis that came out about a month ago that looked at 46 previously done studies, kind of analyzed the existing data. And the result of that was kind of mixed. And what they said was that it appeared from their analysis there was an association potentially between use of acetaminophen or Tylenol during pregnancy and neurodevelopmental disorders like autism or ADHD, but that they couldn't prove a causative relationship there. So you can say
that's the key. There's a potential association, but there is not a direct link or cause. And part of that too is because there's so many other things happening. It's not really a control in these studies, correct?
That's right. And so if you are taking Tylenol for a fever, for an infection, for pain, and then subsequently have a child who's diagnosed with autism, is it because you took Tylenol? Is it because of the infection, the fever, the pain, or is it because of something else entirely? We should note that autism is thought to be influenced by a lot of genetic factors, as well as potentially environmental factors. It's very complex. There was a lot that we heard from the president that I think had a lot of people kind of taken aback. One thing that I think folks will find potentially problematic is this idea that he suggested Tylenol should only be used during pregnancy for very, very high fevers if you can't tough it out. And it's dangerous to not treat a fever during pregnancy. And so Tylenol is a really important medication to be able to use to treat fever. And so the data don't necessarily support what we heard from the president.
So in terms of, and just remind us, right, the reason that it is so dangerous not to treat a fever during pregnancy is not just for the woman who is pregnant.
Doctors are giving Trump bad news. They're warning him. They're saying, sir, we know that doctors have been giving Trump bad personal health news. We don't need, we could speculate on that, I think, pretty fairly. Trump's never been honest with the American people about his health, so I think we don't owe him courtesy in respecting his health privacy and whatnot. He's definitely sick. He's definitely sick. He looks like he had a stroke. Did he have a stroke? I don't know. But he's certainly got really bad vein problems relating to a heart issue. This is not a healthy man. But beyond all that, he's creating health emergencies. He's creating them with how he approaches everything from vaccinations to now making up a fairly spurious link that most medical professionals reject, all because him and RFK Jr. want to try and look like they're solving an issue. This is not based in science, and women will suffer because of it, and babies as well. And don't think this for a second that this is just an issue of comfort. Doctors have noted that, this link between autism and Tylenol or whatever, it's not really real. He's just saying, I'm doing it based on vibes. Right? He literally said, this is just me talking here. But Trump's not a doctor or a scientist or a pharmacist, right? He has no medical training, no relevant scientific training. But remember that Tylenol and stuff, it's for headaches, but it could also help with things like fevers and whatnot, right? And when pregnant women are sick, it's not just their comfort at stake. And I don't think we should discount the comfort of women, but it's not just their comfort. It's if you have a fever, if you have severe illnesses when you're pregnant, it affects the baby because the baby's a part of you, right? And so when you're sick, the baby's sick. And it's probably the case that it's better to take Tylenol and be less sick and be healthier for your baby in utero, the fetus, right? Than it is to be sick, right? We understand this. When a woman is sick, it affects the baby in development. Donald either doesn't get this or doesn't care. This is a man who does not respect expertise. He doesn't. He does not respect expertise. And I'm not suggesting experts are never wrong, but you should trust experts until given a reason not to. And Donald doesn't understand that.